Ever feel like you're doing all the right things and still wondering why your body feels off? You eat well, you train hard, your labs say you're fine, but deep down you know something's slipping. You're not alone and you're not crazy. I'm Daniel Rasmussen, founder of Echelon Center for Longevity, and I've spent 2 decades helping high performers like you to reverse aging, reignite vitality, and finally get answers. On Unbreakable Vitality, we go upstream. We talk peptides, stem cells, precision diagnostic testing, reversing the age of your arteries, all the innovative science-based tools to take back your health span so that your next decades are your best yet. Because aging is real, but decline is optional. So you've probably been told or you've heard that it's permanent. Once plaque or calcification shows up in your arteries, the assumption is game over. Slow it down, maybe. Medicate it, monitor it, but reverse it? Not a chance. That belief has shaped how millions of people live cautiously, fearfully, waiting for the next event, hoping it doesn't come. But what if that belief is outdated? What if reversal is not only possible, but already happening? At the Echelon Center for Longevity, we've seen it firsthand. Vascular age dropped by a decade, calcification scores reduced, soft plaque stabilized, and even regressed. In today's episode of Unbreakable Vitality, I'm going to show you exactly how that happens. The science, a few stories, the protocols, and the hope you've probably been told doesn't exist. Because aging doesn't have to be a one-way street and plaque doesn't have to be your story. Let's get into it. Let's begin by asking a simple but loaded question. Why does the system insist that plaque and calcification are permanent? It comes down to 3 things: outdated beliefs, limited training, and a reactive medical model built on crisis, not prevention. So for decades, cardiovascular medicine has been revolving around one guided narrative: manage the disease, not reverse it, not prevent it, just manage it. Keep it from getting worse, maybe, keep it from killing you. Yet, the standard approach is straightforward: prescribe a statin, maybe a beta blocker, recommend aspirin, suggest heart healthy eating, whatever that means, and monitor. That's it. The focus is symptom suppression, not regeneration of the tissue. That's the model most clinicians are trained in. Most genuinely believe reversal is impossible. Talk to any doctor, they'll tell you that it's not possible. They haven't been taught the science of vascular remodeling, endothelial repair, mitochondrial regeneration, or even nutritional repletion. So if you ask your cardiologist, simple question, can I reverse plaque? They're going to say no. But we can slow it down. And that answer isn't malicious. It's just based on a narrow clinical lens that they've been taught to look through. Here's what the lens misses: the dynamic nature of vascular biology, the role of soft plaque versus calcified plaque, the impact of lifestyle on gene expression, not just symptom presentation. Think about it like this: if you burned your skin, would your body regenerate new skin cells? Of course. If you break a bone, does it heal? Absolutely. So why do we assume the vascular tissue, a living dynamic system, is somehow beyond repair? The truth is your arteries are capable of healing, but only if the environment shifts. The calcification seen in arteries is the result of decades of damage, from inflammation, oxidative stress, poor nutrition, hormone decline, and lack of metabolic flexibility. Calcium doesn't just show up, it's deposited as a protective scar over soft, inflamed plaques. But here's the good news. If we can stabilize that inflammation systemically, restore endothelial health, and shift calcium metabolism, we can not only prevent further damage, we can reverse the biological environment that made it happen in the first place. We've seen it. Patients reduce plaque volume, reverse their carotid intima media test scores and measurements, and they've dropped their vascular age by over a decade. But here's the catch. None of this happens inside the standard medical model because the standard model doesn't believe it's possible, and therefore it doesn't look. Crazy, isn't it? At the Echelon Center, we look, we test deeper, we aim higher, because managing your risk is not the same as reclaiming your vitality. So I want to show and discuss exactly how plaque forms a little more in depth, and why the process that creates it is also the process that can be interrupted, stabilized, and reversed. Focus on prescriptions and procedures versus on root cause. Doctors are not trained in reversal science nor upstream detection. So to understand how plaque can be reversed, we first need to understand how it actually forms. It starts upstream with endothelial dysfunction, which is what homocysteine levels show us. The endothelium is the inner lining of your arteries. It's just one cell layer thick. It plays a massive role in regulating vascular tone, inflammation, blood pressure, blood clotting, and nutrient delivery. The glycocalyx is a thin sugar protein mesh that acts like Teflon, keeping the blood flowing smoothly, slick, lubricated naturally, almost like a nonstick pan. But when that glycocalyx is damaged by high blood sugar levels, diabetics, pH acidic balance in the blood, oxidative stress, toxins, sleep deprivation, and chronic stress, the endothelium becomes vulnerable. Tiny little cracks start forming in the cellular lining, disrupting those tight junctions that hold your vascular integrity together. Here's where the process starts to accelerate. LDL cholesterol, which normally delivers fats, vitamins, energy, triglycerides to all of your tissues throughout your body, now gets trapped in those little cracks of the damaged endothelium. And there it becomes oxidized LDL, a toxic inflammatory molecule that triggers the immune system. So then your immune systems come in, primarily monocytes and macrophages, and they rush in to clean it up. But in doing so, they transform themselves into what are called foam cells, bloated, sticky, and inflammatory cells now. These foam cells start to accumulate. They start to form soft plaque. This isn't the hardened plaque on a scan yet, but it's dangerous. Soft plaque is unstable. It can rupture and break free, and it can lead to a sudden cardiac event. Even if your arteries aren't fully blocked, death by surprise, stroke by surprise, it's that silent killer creeping up. As this process continues unchecked with ongoing inflammation, just keeps coming and coming, hormone decline keeps getting worse, oxidative stress is ramped up, your body tries to stabilize that soft plaque over time, and it starts to deposit calcium, a shell, to harden and protect the damaged area, because your body knows this is not good. So this is what we see as an arterial calcification on CT scans and calcium scores. But by the time calcium scores are showing something, man, you're way downstream. It's often now you're going to be chasing after a downstream effect rather than prevention. So don't wait for the calcium score. Get a CIMT, the heart threat scan. Most conventional medicine sees calcification as the end stage, irreversible, static, untouchable. But in reality, calcification is just a scar. It's where scar tissue is forming, not a verdict. It's your body's attempt to wall off inflammation, but not necessarily a death sentence. It's actually a little more stabilized by that point. So here's the critical insight. That same process that creates plaque, oxidative damage and inflammation, immune overactivation, all that can also be interrupted and reversed when you address the root causes. What's more, early stage plaque that is soft is highly modifiable. We've seen clients reduce their intima media thickness, stabilize vulnerable plaque, and stop the cascade before calcification sets in. Even calcified plaque can shift. While calcium may not dissolve overnight, it can be remodeled, reabsorbed, stabilized, and neutralized as inflammation and metabolic stresses are removed. At the Echelon Center, we've witnessed measurable regression using interventions like our whole gamut, hormone optimization to reduce vascular inflammation, IV nutrients and antioxidant support, glutathione boosting, glutathione complex to improve your own liver's glutathione production, endothelial repair peptides, magnesium, vitamin K2, MK7 for calcium metabolism, ozone therapy to reset the redox balance. We'll break those down in the next segment, but for now, remember this: your plaque didn't form overnight, and it doesn't have to define the rest of your life. Your biology is adaptable, your arteries are dynamic, and if you change the environment, you change the outcome. It's as simple as that. Calcification as a scar, not a solution. You're not doomed. Your biology is adaptive. So now that we've outlined how plaque forms, from endothelial dysfunction to foam cells to calcification, let's talk about how we interrupt, stabilize, and roll back the clock and reverse that process. Reversal isn't about a single drug. It's not about a single magic bullet supplement or a single biohack. It's about shifting the entire biological terrain inside your body, from inflammatory to regenerative, from calcifying to remodeling. So let's start with the soft plaque first. This is the most unstable and dangerous type. That early plaque formation, when it's just starting, that's when you're most likely to have a stroke or a heart attack event. This is why you don't wait around for it to get worse. And thankfully, it's also the most reversible. With the right strategy, we can reduce that inflammation, stabilize the foam cells, and restore endothelial function so that the body no longer needs to wall off the damage with calcium. So how do we do this? Well, we got to reduce the oxidative stress. We use IV ozone therapy, glutathione precursors, polyphenols to reset the redox balance, peptides to restore your lining and your barrier tissues of the body. And this reduces oxidized LDL, stabilizes those foam cells, and downregulates vascular cytokines. Then we start to enhance your body's endothelial repair. Remember, endothelial tissue is the inner lining of your arteries. So we use a peptide called BPC-157 and growth hormone secretagogues like CJC-1295, ipamorelin, sermorelin, tesamorelin. And then those peptides signal support of endothelial regeneration and vascular elasticity to directly nourish and restore the glycocalyx. Remember that little slick lining, like a nonstick pan coating on the inside of your arteries? To restore those, we use things like arterial HP, a clinically validated nutraceutical by Calroy Sciences. Arterial contains rhamnin sulfate extracted from Monostroma nitidum, a rare green seaweed. It also has antioxidant-rich polyphenols. Other glycocalyx supportive compounds that have been shown to improve arterial flexibility, support tight junction repair and integrity, and reduce that permeability or the leaky component. We also increase nitric oxide naturally through things like arginine, citrulline, and strategic vascular movement. We change your toothbrush from plastic to natural bristle. We use different toothpaste, get you off the fluoride. We change your microbiome of your mouth so that your body can actually utilize the nitric oxide. We have you stop using mouthwash, killing off your microbiome. All of these things you have to take into account. Then we recode the calcium metabolism of your body. This is where vitamin K2 or MK7 and magnesium and vitamin D3 come in. Vitamin K2 shuttles calcium out of the arteries, out of bone spur, abnormal calcium deposits, and back into healthy bone structure lattice, while magnesium improves the vascular compliance and reverses microcalcifications systemically in other parts of the body. Next, we work on hormones. Hormones signaling such as low testosterone, estradiol, DHEA, and cortisol imbalance all worsen arterial damage. So we've got to rebalance these things with hormone optimization. And when we reach a maximum with hormone optimization, then it might be time to consider bioidentical therapies, bioidentical hormone replacement therapy, adrenal support, and circadian rhythm restoration. Now we've got to go to the gut and detox systems of the body. Through our GI map testing, we often find massive gut dysbiosis, which is the imbalance of your good versus your bad bacteria or unfriendly bacteria. We often see suppressed secretory IgA, immunoglobulin A, or high LPS, lipopolysaccharide. These are all driving systemic inflammation from the gut, translating into systemic inflammation. We use precision gastrointestinal protocols to lower permeability, reduce inflammation, and lighten the liver's detox burden. Next, we start working on mitochondrial resilience and oxygen delivery. We target mitochondria with CoQ10, NAD precursors, and PQQ at the right dosage, at the right time, at the right amount. We improve oxygen uptake and delivery using exercise mimetic peptides like MOTS-C, hyperbaric oxygen support, IV ozone therapy, and strategic movement fitness stacking. All these interventions are designed and customized and personalized, and they're not theoretical. They are being used right now to change that vascular outcome for our clients. That these outcomes were once thought to be irreversible. We've had patients lower their oxidized LDL by 60%. That is significant. They've cut their vascular age by a decade or more and shift their carotid intermedia scores from high risk to subclinical. But it only works because we test the right variables and we track the right outcomes. This is not alternative medicine. This is applied human biology, personalized to your vascular terrain. So I want to show you how we track those shifts in real time and why data is the most powerful motivation you'll ever have. Decalcification pathways such as vitamin K2 and magnesium and endothelial repair. We'll discuss a little bit about that. The role of peptides, ozone, IVs, gut detox, hormones to get the terrain to shift. Here's the part that makes all of this real, tracking the transformation. So in previous episodes, you've heard us talk about reversal, stabilization, and regeneration, but how do we know it's working? How do we prove that someone's vascular age is actually dropping? We use three primary technologies. The heart threat scan here in our office is carotid intermedia test. It's our trademark for this test. And this protocol allows us to get a baseline, detect early stage plaque formation, measure soft versus heterogeneous versus calcified plaque formation. All three of those matter. We track the changes in your arterial wall thickness over time. So this is a standard ultrasound. You have to be trained in the expertise in how to read, measure, and interpret. Echelon's heart threat scan uses advanced algorithms and clinician interpretation to show you where your vascular age stands and how it responds to our intervention. The next test we do is true age biological age testing. So we combine vascular data with the epigenetic methylation analysis using true age. And this shows us how fast your body is aging on the DNA cellular level compared to your chronological age. If your biological age is 57, but your calendar age is 49, that's a problem. We've helped patients reverse that trajectory and regain 8 to 15 years in less than a year. So next, we do an ankle brachial index, or ABI. This simple but powerful test compares blood pressure in the ankles and the arms to detect peripheral artery disease, which is one of the first signs that vascular damage is becoming systemic. Together, these three tools give a full body map baseline. We're also checking the comprehensive longevity blood biochemistry panel. But these three that we just spoke of give a full body map. How thick or damaged are your artery walls? How old are you biologically? Is plaque formation systemic or not? So let me share a story. We all love stories. We had a 62-year-old male came to us with a brain fog, fatigue. He had some creeping blood pressure creeping up, and his labs from a PCP said everything was fine. His cholesterol was artificially lowered because he was on cholesterol meds. So we didn't really know what his cholesterol really was. It was being hidden by this medication. His heart threat scan revealed soft plaque formation in both carotids, which means he has soft plaque formation forming systemically through his body. His vascular age was 69 and his biological age was 63. So 4 years older than his calendar age. So we started him on a layered approach protocol, ozone therapy, antioxidants, umbilical cord plasma infusions to activate those tissue growth factors of a younger person as if he were in his 20s. We did a complete gut repair protocol after we did the GI map, and with targeted reconditioning and peptide therapy with the Echelon Peptide Labs, EPL, and our mitochondrial support. It's a whole protocol of supplements and nutraceuticals that we used. I mentioned some of those earlier. At his 9-month follow-up, he had to make a lot of lifestyle changes, and it was a challenge. So we coached him through it, how to stack those tiny little changes to become part of his new lifestyle, his new identity as his healthier, younger version of himself. At his 9-month checkup, his vascular age should drop to 54,
His biological age on his true age test had reversed to 50. Blood pressure, totally normal. Off blood pressure meds. His mental clarity returned. The data didn't just tell him that he was younger, it made him believe he could be younger. And therefore, when he believed he could be younger, his brain started to get on board with the whole process. And that's why we track everything, because when you see your body regenerating, it reinforces everything you're doing. So in this final part of today's episode, I'm going to show you why this moment right now might be your turning point. What is your turning point? So at this point in the journey, you may feel something you haven't felt in a long time. Hope. Maybe it's speaking to you. Maybe you can add years to your life and quality to those years. It's not just about living longer. It's about living right and living well. It's not hype, not wishful thinking, but the realization that change is not only possible, it's measurable. This is what I call the hope gap. The moment when someone goes from managing decline to engineering resilience. You are in the driver's seat, not your cardiologist. For decades, we've been conditioned to believe that aging is inevitable, that decline is normal, and that once damage is done, there's no coming back. That is true to a certain point, as long as you catch it ahead of time, upstream. But that belief was never grounded in personalized biology. It was built on population averages, outdated diagnostics, and the fear of a false hope. But now we have data, we have tools, and we have people like you who are willing to challenge that script. When a patient sees their vascular age drop by 10 years, or watches their plaque stabilize, or gets a report that shows their biological age reversing, something shifts. They stop waiting around for things to get worse. They stop fearing that little voice in the back of their head, wondering when the other shoe's going to drop with their health. They start having peace of mind. They start living differently, because real measurable reversal isn't just a physical transformation. It's a psychological one. It's a mindset shift. You start to ask new questions. What else is possible? How much better can I feel? If I can feel this much better, what now can I do? What else have I been told isn't reversible in my health? Where else have I accepted decline as inevitable? You move from being a patient to being a participant in your health, no longer at the mercy of broken systems or generic one-fits-all advice. This is your turning point, not because I said so, but because now you know it's possible. Now you've seen a roadmap. Now you've seen the numbers. Now you've seen the biology that says, yes, you can regenerate. So the question is no longer, can it be done? It's, will you choose to do it? So if you've ever been told your plaque can't be reversed, or your biological age or age-related decline is just part of getting older, you now know that's not the full story. You have more power than you've been told you have. And the next step is very simple. Take that free vascular age quiz at echelon-longevity.com/quiz. And in just a few minutes, you'll get a personalized report, albeit very simple, on how fast you're aging biologically and whether you're a candidate for our proven heart threat scan and reversal protocols. Your future health isn't just a guess, it's a measurement and a choice. So next time on Unbreakable Vitality, we're diving into one of the most important and most overlooked pillars of long-term health, lifestyle architecture. You're going to learn how to design your environment, your routines, your behaviors in a way that makes vitality automatic, not effortful. Because peak performance shouldn't be a grind. It shouldn't be laborious, arduous experience. It should be built into how you live. It should become automatic. It should become who you are. Next time, we'll talk about the power of lifestyle architecture and how to create an environment where longevity isn't something you chase after. It's something you live every day. I'll see you there.
If you're feeling like your energy, your edge, or your clarity just isn't what it used to be, you're not alone. But you're also not stuck. Every week on Unbreakable Vitality, we explore real strategies to reverse aging, reclaim vitality, and rewrite what's possible. If today's episode gave you even one insight, pass it on. Then go take the free vascular age quiz at echelon-longevity.com/quiz to see how your body's aging. subscribe, leave a review, and follow us because your future isn't on autopilot. You are building it and you're just getting started.